بسم الله الرحمن الرحيم، والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. اليوم سأتكلم عن neonatal infections. Neonatal infection is important condition in the neonatal period since it has got high mortality and morbidity rates. Neonatal infection is classified either as bacterial, viral, fungal types. It can also be classified as major neonatal infection, and these occur in the first 3 days of life, and minor neonatal infection, which occur in from 3rd day up to 28 or 30 days of life. It can also be classified as prenatal or congenital infection or torches. Torches stands for toxoplasmosis, rubella, cytomegalovirus, and herpes simplex, and the last is for syphilis. Correction. Sorry, in the neonatal sepsis, the classification, it could either be early neonatal infection, which can occur in the first 3 days, or late neonatal infection, which occur from 3rd day up to 30 days. Also, neonatal infection can be classified as major, and these are septicemia, meningitis, pneumonia, or minor like skin infection, conjunctivitis, fungal oral thrush, and maybe umbilical sepsis. Also can be classified as prenatal and postnatal. Thank you. These congenital infections are congenital syphilis, which is characterized by stuffiness, rashes, and also hepatosplenomegaly. And later on, Huntington tooth may appear later on, and sabertibia. Number 2 of the neonatal infection is rubella, which is characterized by deafness, cataract, congenital heart disease, and small head size. Also is hepatosplenomegaly. Number 3 is cytomegalovirus infection, which is characterized also by rash and hepatosplenomegaly. Toxoplasmosis also has a similar picture of rash, jaundice, hepatosplenomegaly, and large head size. Histoplasmosis is a fungal infection which has a similar picture, and some of these congenital infection has got treatment, like congenital syphilis and toxoplasmosis, while others others didn't have treatment. Number 2 or B is perinatally acquired infection, and this happens when the baby passes through the birth canal, and this is mostly bacterial infection, and it causes one major infection like septicemia, meningitis, pneumonia, or can cause other infections like skin infection or some of the minor. One of the important neonatal infection acquired at birth is neonatal tetanus, which is serious infection, and it is acquired by a cut, unhygienic cut of the umbilicus cord, so that tetanic pus get entrance into the baby and then causes the disease, which is characterized by locked jaw or trismus and characteristically looking face, it's called rhesus sardonicus, an inability to feed, stiffness of muscles, and spasm. And the spasm is the most serious thing about it, because during this spasm the child might get suffocated and die. The mortality rate of neonatal tetanus is very high, ranging around 75% in best hands. For the treatment of this disease, you should provide sedation by drugs like chlorobromazine or diazepam alternating, or other drugs also can be used. And this is to relax the muscle and to prevent the spasm. Then you give anti-tetanic serum to neutralize the toxin. And nowadays it is tetanus immunoglobulin is given instead of anti-tetanic serum, because it can cause reaction, immunological reaction. The drug which is used to kill the organism is benzyl penicillin, or sometimes also metronidazole can be used. For prevention of neonatal tetanus, you give tetanus vaccine to the pregnant mother in the second trimester, the first dose, then followed 1 month apart by another dose, but the second dose should be 3 weeks before delivery, so as to give chance for the antibodies to develop. And this will give immunity for 6 months. Then on the coming pregnancy, another dose is given, and this will give immunity for 1 year. And on the coming pregnancy, a fourth dose can give immunity for 5 years. And a fifth dose in the coming pregnancy can give an immunity for 10 years. Other organisms like gonorrhea, which can cause conjunctivitis, and if not well treated, it can lead to blindness. Also, chlamydia can give inclusion conjunctivitis, and this happens late on the 7th day. And it can also give pneumonia, which is serious and can be treated energetically. Monilial infection, it is a common fungal infection caused by Candida albicans, called oral thrush, and this can be treated by mycostatin oral drops, or meconiazole oral drops, or even gentian violet. Number 4, most serious organism is beta hemolytic streptococci, which is gram-positive and can give rise to serious infection like septicemia or meningitis, and can also give pneumonia. Other organisms also can be involved, but these are the most common organisms. Postnatal infection should be expected if or the risk factor for developing a neonatal infection is if the baby is premature, and if the baby undergone instrumentation by, for example, forced delivery or ventouse delivery, or if he had resuscitation, and if the mother is birexial at later. Also, if the mother has prolonged rupture of membrane more than 24 hours, or even more than 15 hours, and if the mother has pathogen detected by high vaginal swab. Also, if the mother has chorioamnionitis. So these are important factors, risk factor for developing neonatal sepsis. The causative organism, the common are gram-negative bacteria like E. coli, Proteus, Klebsiella, and Pseudomonas. Also, gram-positive organisms can be involved like staph and beta hemolytic streptococci. Bordetella pertussis is the coccobacillus. And for this reason, for treatment, you should give broad spectrum antibiotic to cover both gram-negative and positive. Symptoms and signs of neonatal tetanus. You have to have high index of suspicion about neonatal sepsis. If the mother says that the baby is not well looking, or is crying, or refusing to feed, then you should suspect sepsis. And the symptoms are hypo or hyperthermia, poor weight gain, pallor, mottled skin, jaundice, vomiting, anorexia, cyanosis, edema, hemorrhage, and poor feeding, apnea, and tachypnea. Any part of the systems can show these signs, symptoms. For it, if you should to diagnose it, you should have, as we said, high index of suspicion, and then you take a history, see to elucidate the risk factor, and then you do a rapid examination, and then you order some investigation that helps in detecting the organism. First, you take swab from nose, throat, ear, umbilicus, or any suspicious area of the skin for culture and sensitivity. Also, stool or rectal swab for culture, urine for culture, and most importantly is blood culture. And also white blood count, total and differential, can show granulopenia or neutropenia, or sometimes increased neutrophils. And the most important thing is the band to total neutrophil ratio, or the immature to total neutrophil ratio, which, if it is more than 16%, indicates bacterial infection. And this can point to infection more than other things, except for the cultures. Also, you can do C-reactive protein, and which can be high, and ESR also can be high, and platelets count, which can show thrombocytopenia. Also, a lumbar puncture is one tool, important tool for detecting infection, especially if meningitis is in the picture. And also, chest X-ray can be done if there is suspicion of pneumonia, and abdominal X-ray to see, especially in neonates, for necrotizing enterocolitis or any other signs. And after establishing the diagnosis, then you should immediately start antibiotic even before the result of culture to come. You should take samples and send it for the lab, but you don't wait for the culture for the result to come. You should institute broad spectrum antibiotic. The best can be used, and you can start initially by benzyl penicillin plus gentamicin, or ampicillin plus gentamicin or ambiclox plus gentamicin, and colchicine can be added if there is suspicion of staph infection. Also nowadays, due to the new era of cephalosporin, you can give cefotaxime plus gentamicin, cefotaxime plus ampicillin. Or if there is suspicion also of staph, you can give cefotaxime plus vancomycin. Other antibiotic can be involved according to the culture. You can go up to meropenem or fourth generation cephalosporins and so on, depending on the culture result. Other thing for treatment of neonatal sepsis, other than drugs, other than antibacterial drugs, you can watch for fluid and electrolyte balance, and to feed the baby well, either by nasogastric tube or parenteral nutrition in cases of severe prematurity, and you may resort rarely to exchange transfusion. Some authorities say that giving immunoglobulin is beneficial, but this is still under survey. For prevention, the most effective is hand washing, where hand washing is the most effective preventive measure. Other measures can be used also, like wearing mask or changing clothing before entering the NICU, or changing shoes and so on. But the most important is to hand wash even after examining every neonate. And by this we come to the end of neonatal infection, and thank you. Now we are coming to another topic, which is neonatal seizure. Neonatal seizure is important disease, can cause high mortality and morbidity of the neonate. It can be fatal initially, or can cause later on neurological deficit. Its causes is the most common one is hypoxia, hypoxic ischemic encephalopathy, which occurs around birth due to birth asphyxia. Infectious causes can be like septicemia, meningitis, encephalitis, and even malaria, or congenital infection like torsus. Also, metabolic causes involve hypoglycemia, hyponatremia, hypernatremia, hypocalcemia, hypomagnesemia, pyridoxine dependency or deficiency, impaired of metabolism, and hyperbilirubinemia, which can give kernicterus. Trauma and intracranial hemorrhage is important causes. That intracranial hemorrhage can result from trauma, or from anoxia, or from malformations of the vessel in the brain, or congenital coagulation defect. Also, cerebral malformation is one cause of neonatal seizure, and as I said, malaria. But there is one entity called benign familial neonatal seizure, which its name implies that it is a benign condition that happens in families. The types of neonatal seizures are four. Number one, subtle seizures. Subtle means not apparent, and it can be considered by lay people as normal phenomena. But for doctors, it is considered as seizure, like arrhythmic eye deviation or blinking, lip smacking, bicycling, apnea, bradycardia. Number two is generalized tonic. By the way, the neonate didn't have tonic clonic infection because his central nervous system is not well developed, and this is confined to older children. Number three, clonic seizures, which could be multifocal or focal. Number four, myoclonic seizure, which can also be multifocal or focal. Tonic stiffening followed by apnea is also considered a seizure. For the diagnosis, you have to have good history and rapid examination, and then to detect, to order some investigation to elucidate the cause. About 90% have underlying cause, and 10% without detectable cause. Full neurological examination, as we said, is mandatory. And then you do what is called septic and torch screening and metabolic screening. And a lumbar puncture is important investigation. And then you can do an EEG and brain imaging by ultracranial ultrasound or CT brain or MRI. All these investigations should elucidate the cause, which can be tackled after stabilizing the patient. For treatment, you have first to see that the patient is well stabilized, his ABC, airway, breathing, cardiac status, and then to use drug. For abortion of seizure, you use diazepam, but one should be careful about using it because it can cause respiratory depression. And it is given in a dose of 0.3 milligram IV or 0.5 milligram rectally, or lorazepam. And if this didn't stop the seizure, then you can give phenobarbital in a dose of 20 milligram per kg loading dose, and then later on can be repeated at 12 or 24 hours. If it didn't stop the seizure, then you can resort to phenytoin in a dose of 15 to 20 milligram given loading doses intravenously, and then later on 12 to 24 hours later, and later on you give maintenance dose. After if all these didn't stop the seizure, then you can resort to midazolam, which should be given in ICU setting in infusion, and after that then the seizure can stop. If not, then you can resort to anesthesia. But I think most of the seizure can stop by this drug, and then you treat the underlying cause accordingly. For example, if you suspect hypoglycemia in infant of diabetic mother or hypocalcemia, you can give glucose 10%, 2 ml per kg, and also you can give calcium even before the result to come. The coming treatment or follow-up is by drug which is effective against the initial or underlying cause. For the cases, if investigation came normal, then you may suspect pyridoxine dependency or deficiency, and this can be treated by giving 100 milligram intravenously of pyridoxine. And if it is due to pyridoxine dependency or deficiency, the seizure will stop after a few hours. And by this, we come to the end of neonatal seizure. If there are questions or comments, then I am ready to answer. Thank you very much.